We do have two people here with us today. We have Amy and we have Renata. And the Actors Fund has, as I mentioned, they have stepped up to be the statewide navigator for New York. But as a national organization, they have been busy for the past couple of years traveling the country, offering training sessions on the Affordable Care Act and how individual artists can comply. So even if you're not based in New York, which we usually get people with APAP from all over the country here, Renata and Amy will be able to address your questions. So with that, I'm thrilled to invite Amy and Renata, who will be running this session. Thank you.
Thank you very much, everybody, for coming. I am curious where people are from. How many people are from New York? How many people are not from New York? One person? Okay, all right. And where are y'all from? Chicago. Chicago. All Chicago. Philadelphia. Okay, great. All right. So what I'm going to do today is I'm going to review some of the things that Sarah talked about. I know that she had the unenviable task of going over everything, and I'm sure that some things maybe got lost in the shuffle a little bit in your brain, so we're going to go over the major points that she addressed, and then we're going to get into the nitty-gritty. So what is it like to enroll? How do you enroll? I can answer any questions that you have about documenting your income, for example, or whether you're eligible for Medicaid or not, what the subsidies look like, what the plans look like, those kinds of things. So I'm going to go over all of that stuff. Please feel free to ask questions as we go along. Do know that I'm going to start by giving you an overview of vocabulary. Sarah mentioned that it's difficult to make decisions if you don't know what some of these terms mean, right? Like deductible and stuff. So we're going to go over vocabulary first. And then we're going to talk about all the major things that have happened, and then we're going to go into detail about Medicaid, subsidies, rates, plans, etc. The Actors Fund, well, I'm the Director of Health Services for the Eastern region of the Actors Fund. And as Amy said, the Actors Fund is a nationwide human services organization that helps everybody in entertainment and the performing arts. We've been around for over 130 years. We have 4 main service areas: social services, housing, employment and training, and health services. And one of the aspects of social services is the Dancers Resource Center, which is a really, really wonderful program for dancers. So I'm going to bring up Amy Wilder, who's the head of the Dancers Resource Center.
Hi. I'm not live, so can you hear me up there? Okay, cool. Hi. So hi, this is Amy, and it's great to see all you guys here. And Renata's a fabulous leader, and she really knows this stuff. She's been working with it a long time, so it's great that you're here. The Dancers Resource is this program of the Actors Fund, and as Renata said, the Actors Fund's been around for a long time. The Dancers Resource has been around about, I think, 7 years at this point. And really specifically, we do a lot of the things that we would do for anyone that comes to the Actors Fund, helping in cases of financial distress, like somebody's, God forbid, apartment burns down, or just work falls through and you can't pay rent 1 month. Various types of problems, or illness or injury, especially injury. That was one of the reasons why the Dancers Resource was established. So we're looking to also, in the next few weeks, I'm going to be starting a support group for injured dancers. We are for professional dancers and choreographers, so not just for, dancers, but choreographers as well. And we do try to just get people connected to whatever it is that somebody comes in and they might need. So I'm happy afterwards to answer any questions that people might have specifically about the Dancers Resource or the Actors Fund as a whole, if you have any specific questions.
Amy failed to mention that she is an amazing dancer herself and was at ABT for years. So, Amy mentioned that we help in cases of crisis, and that includes financial assistance. We also have housing. We have fantastic housing in Brooklyn at the Skirmerhorn House that is actually the home of the Brooklyn Ballet. And we have housing in Manhattan. We have a nursing home in New Jersey that I cannot wait to go to. It's so fantastic. And housing out in LA. We are a national organization, so we have offices out in LA and Chicago as well. The employment and training services help people find sideline jobs, and health services help connect people with health insurance and health care. We have an entirely free clinic for people who are uninsured on 57th and 10th Avenue, okay? In order to qualify for the services there, you either have to be a union member. I know that a lot of dancers aren't union members, so you also can show that you've made $3,000 in 2 of the last 5 years in the industry, and then you'll get services from our doctor there who's wonderful. It's really more like a doctor's office. And he is a professor at Columbia Presbyterian. We have specialists, some at Harkness Dance Center, et cetera, that see our clients for free. So that is what the Actors Fund does. Now, like I said, we're going to go over vocabulary first so we're all on the same page. So I think most of you know what a copay is. It's a flat fee for a service. Coinsurance is a percentage of the bill, okay? So for example, Medicare is run on coinsurance. Medicare, as Sarah mentioned, is for people 65 and over or the disabled. And you pay 20% of the bill and the government pays 80% of the bill, basically. So coinsurance is always more expensive than copays because coinsurance accurately reflects medical costs. And as Sarah mentioned, medical costs are crazy right now. I don't know if any of you know how much it would cost to spend the night in a hospital, but the bed alone is about $4,000. Okay, so you're really better off staying at the Ritz and getting the doctors to come in and see you. It's much more comfortable. So medical costs are extremely high. That was one reason for the Affordable Care Act. The Affordable Care Act does 3 main things that Sarah mentioned. It tries to make insurance more affordable. It has brought down the cost of premiums. In New York, it's brought it down by 50%, okay? And that does not include subsidies. It's increased accessibility to care, right? So anybody can have insurance, doesn't matter what your pre-existing conditions are. And it's also made insurance more comprehensive. And it's also done something which is very important, which is institute out-of-pocket maximums. And if you go down past deductible and premium, you'll see out-of-pocket maximum. That is the maximum amount that's coming out of your pocket in a year for services. This is really important because medical debt was the primary reason for bankruptcy in this country, right? And that's shameful. Someone should not have to go into bankruptcy because they happen to get sick. And so what the ACA does is it says, you know what? We're going to cap the amount that comes out of somebody's pocket in a year for medical expenses. The maximum amount that can come out of your pocket is $6,350 as a single individual or $12,000 as a family. Those out-of-pocket maximums are reduced if you're eligible for subsidies, and we'll talk about that later. Okay. A deductible. This is important. Sarah mentioned that she didn't understand a deductible. A lot of people don't understand deductibles. So a deductible is what you pay up front before your coverage kicks in. And a lot of people in New York aren't as familiar with deductibles as people in other states because in other states, high deductible plans are more common. But a deductible is what you pay up front before you go into copays and coinsurance. So for example, if you have a $500 deductible, on your plan, you're paying the first $500. If you go to the doctor, you're paying the full amount. Let's say the doctor charges you $250 for an office visit. You're paying $250, okay? And the doctor says we need an x-ray. The x-ray costs $150, you're paying $150, right? Now you're at $400, if my math is correct. And the doctor says you're gonna need medication that costs you $100. You're paying that full cost. Now you've reached your $500 deductible. The next time you see that doctor for a follow-up, you're going to pay your copay or your coinsurance or whatever it is according to the terms of your contract, right? You're not going to pay the full amount. So that's the deductible. The premium is what you pay every month just to have insurance. The deductible, coinsurance, and copays count towards the out-of-pocket maximum under the Affordable Care Act, okay? So, for example, if you have a $500 deductible and a $2,000 out-of-pocket maximum, paying the first $500, And then between $500 and $2,000, you've got co-pays and co-insurance. And then once you reach $2,000, the insurance company takes over the rest. Does that make sense? Yes?
So when you reach the out-of-pocket maximum, you no longer have to pay a copay
That's right,
for that year?
for that year.
And it's annual, right?
It's annual.
Right.
Yep. An HMO is a type of insurance company and a type of policy. So with an HMO policy, you have to go to their network of providers. So for example, Health Republic in New York uses the Magna Care network of providers. You have to go see Magna Care doctors, doctors that accept Magna Care. Okay? A doctor can accept many different kinds of insurance, or they can choose not to accept insurance at all. But with an HMO, you have to go to their network, or to doctors that accept that insurance. With a POS or PPO policy, you can go out of network. Okay? POS and PPO policies are attractive to people who travel, like dancers. The problem with the exchange in New York is that there are no PPO policies on the exchange. Okay? So you will not have out-of-network coverage in New York on the exchange. What we do when we sit down with people is we say, let's take a look at your individual situation. Do you travel a lot? If you travel a lot, you may not want to go on the exchange. You may say, you know what, I live in California 4 months out of the year. I think I'm better off going off the exchange because I need that out-of-network coverage. What you're doing if you go off the exchange is you're making yourself ineligible for subsidies. Okay, and we'll talk more about that later.
I signed up, I had an EPO.
Okay, so an EPO is a version of an HMO, basically.
Okay.
Yeah.
So, but every state has, I have United Healthcare. Okay, there are United Healthcare doctors all over the country, but you're saying that even if I go to California and use a United Healthcare doctor, it won't be applicable to my insurance?
If you bought on the exchange, that is correct. Yes. HMOs or EPOs cover life-threatening emergencies outside the network only. The federal poverty level is what the government thinks you can live on in 1 year. Sarah mentioned that it's $11,500, right? Totally unrealistic, of course. This number was first created in the 1960s by a social worker who never ever thought that it would be used in the way that it has been, but basically she based it on how much money you needed to not starve to death in the United States. So this number is now being used for a lot of government programs, including ACA, subsidies, welfare food stamps, etc. So that's why it's important to know about. Yes. It is. It applies to 48 states. It's a slightly higher in Hawaii and Alaska, but basically it's nationwide.
And has it changed over the years?
Yeah. So, right. This is the 1963 number. It goes up by like a teeny tiny amount every year. That amount changes generally in March or April. It's maybe $15, $20 a year, something like that. So not a lot. But the subsidies are based on the federal poverty level, as is cost sharing. Okay, the marketplace/exchange. Sarah talked about that. Same thing, marketplace exchange. It's where you're going to go to buy insurance. It's what you've been hearing about, the website, right? It's not a place, it's not a store. If somebody's trying to sell you insurance on the corner, don't buy it. It is a website, and we will talk about the different websites across the country later, where you can apply for Medicaid, apply for Child Health Plus for your kids, buy a private insurance program through the marketplace, get subsidies, and get cost sharing reduction. It is one-stop shop. Okay. The advanced premium tax credit, AKA the subsidy, it's called both a tax credit and a subsidy because what it does is it lowers the costs of your monthly premiums, okay? It's a subsidy if you take it up front every month, and it's a tax credit if you take it at tax time. You can choose, okay? So you can choose to pay your full premium every month and then take the amount that the government says it's going to give you as a tax credit when you file your taxes. Or you can take that credit, that subsidy every month for your premiums. Any questions about any of these terms? Awesome.
Sorry, I
Yeah.
just need to go back to clarify the
Yeah.
HMO and EPOs in New York State.
Right.
So is it correct that HMO, you can't go out of network?
Correct.
And also, you cannot travel, while you're traveling outside of New York State, you can't be covered for in-network.
Correct. Well, out of state would be out of network, basically. So with an HMO or an EPO, any of the plans on the New York State marketplace, they all offer in-network coverage only. As soon as you go outside that network, unless it's a life-threatening emergency, they're not going to cover it.
And that's the only thing that's offered through the New York State market.
Correct.
That's a big gap in New York State.
It is. It is. And I strongly encourage you guys to make your voices heard on the state level, because this is a major issue for our industry, right? I mean, people travel. They live in 2 different places during the year, and they need that coverage. And unfortunately, in New York, there are no PPO plans. The state said, yes, in other states there are. I don't know which states those are, but
Where we should move.
yeah, right, exactly. I believe California has PPOs. The state said at the beginning that there were going to be PPOs at the silver and platinum levels, and there just are none. So we'll see what next year brings, but really make your voices heard on this issue because it is a major issue. Okay, So I'm briefly going to go over what Sarah talked about. What healthcare reform has done so far. Kids under the age of 19 with pre-existing conditions can't be denied coverage. Adults cannot be denied coverage anymore either as of January 1st. Young adults up to age 26 and in New York through age 29 can stay on or enroll in their parents' coverage. And this is something that every New Yorker should know about, that you have this extra leeway. If your policy was issued in New York and you live or work in New York and you're unmarried, between the ages of 26 and 29, you can stay on your parents' coverage. Insurers can no longer retroactively cancel your policy if you get sick. All new plans have to cover preventive services. These include, for example, mammograms, mammograms, pap smears, colon cancer screenings. Some of these screenings are age dependent, of course. Blood pressure, diabetes and cholesterol tests, vaccines, immunizations, flu shots, HIV and STD testing, birth control pills. There's a long list of preventive screenings that are free before you meet your deductible, okay? The important thing to note about this is that they have to be preventive screenings. So for example, if you go in for a pap smear and you had an abnormal pap smear last year, that pap smear is going to be considered a diagnostic pap smear, not a preventive pap smear, okay? Preventive screening. So that is something to keep in mind. So these are preventive screenings. They're not meant to diagnose something that already exists.
But
Yeah.
pre-existing conditions are now
Right. So you can't be penalized for having a pre-existing condition, and so they have to sell you the coverage, they have to cover them, etc. But with these preventive screenings, yeah, you will end up paying. It won't be free if you have a, yeah.
Where do you find a comprehensive list of what all of those are?
Healthcare.gov. So if you go to healthcare.gov and you type in the search bar preventive screenings, you'll get a whole long list. And I have to say the ladies definitely made out on this one because there are a lot more preventive screenings for women actually than there are for men and for children as well.
No.
Yes.
Just a question, just since so many dancers that work in smaller companies might not have health insurance in their company, can they, if they're in that group that you mentioned between 26 or
Yeah.
greater than that, and their parents live out of state, can they still be on their, if they themselves are a New York State resident, can they still be on their parents' coverage if the parents have to be in New York State?
The policy has to be issued in New York State. So for example, the parents might live in New Jersey, but maybe their policy is issued in New York because the company is headquartered in New York. and the kid lives in New York, then that's okay. But if the policy was issued in New Jersey, the parents live in New Jersey, but the kid lives in New York, that's not going to work. Yeah.
I don't think you'd actually save any money, because if you don't make much money in New York, on the exchange, you can get an inexpensive plan. And the mom and dad want to pay to add you to the plan, just have them get a policy. I mean, they can write the check, there's no law against that.
Right, it depends on whether you claim your kids as dependents or not. But oftentimes, people are better off if they're under 29 going on their own if they have a low income. So if you aren't claimed as a dependent and your income is low, you may get a much better deal on the individual exchange. That's true. Insurers can't impose annual or lifetime dollar limits on medical benefits anymore. Sarah mentioned that there's no longer this $1 million lifetime or annual maximum. They can't do that anymore. Insurance companies have to continue to pay for your services. So with the pre-existing condition thing, that really is what it says. You really don't have to worry about pre-existing conditions anymore. This is huge. As Sarah mentioned, laws varied greatly all across the country. There were very few laws, really only 2 laws that pertained to health insurance in this country. One was COBRA, which lets you keep your coverage through a job, and the other one was HIPAA, which has to do with some privacy issues around health, around medical records. But there were no federal laws around health insurance. And so states could do all kinds of crazy things. So for example, in Texas, they could base your premiums and whether they wanted to cover you or not on your reputation. So they could ask people, does this person come home drunk a lot? And I had somebody in one of my seminars who said, in that case, nobody in Texas should have insurance. I love Texas. So this individual states, some states really were kind of Wild West as far as health insurance goes. Now you have to be allowed coverage if you have a pre-existing condition. They can't also divide up your body and sell you insurance for only certain parts of your body, right? We have minimum essential benefits. Don't laugh because I had a woman from Colorado in one of our seminars who said that she was so excited she got a letter from the insurance company that they had approved her, but they had only improved coverage of her arms and her legs. Right. So those kinds of things can no longer happen as well, right? We've got mandated essential benefits, and we're going to talk about what those are. The flip side of this is you have to have insurance, right? And don't let $95 stick in your head. That sounds low. 1% is the penalty if you don't have insurance, 1% of your income. So if you made $33,000 last year, you're going to be paying $330 for nothing, okay? So people will be subject to a penalty if they don't have insurance. There are some exceptions, and those include Native Americans, those with religious objections, for example, the Amish, undocumented immigrants, those who don't meet the tax filing threshold, which is about $10,000 a year, and people who've been uninsured for less than 3 months. So within a year, you can be uninsured for less than 3 months and not be penalized. Okay? Medicaid eligibility has been expanded, and we'll talk about what states have expanded it. New York is one of them, as is New Jersey. Exchanges have begun selling insurance, and subsidies are available to people who make less than 4 times FPL, federal poverty level, okay? So for one person, that's $46,000 a year. For 2 people, it's $62,000 a year. For 3, it's $78,000 a year. You make less than that, and you can get subsidies that will lower the already lowered cost of insurance.
What do you mean by 3 versus like a percentage?
Yeah.
Like, so what if it's more?
So if it's 4, it's $94,000 a year. If it's 5, it goes up. Yeah. So when we're talking about a household, we're talking about people that have a tax filing relationship, right? Either you're married, and it doesn't matter anymore whether you're different sex or same-sex couple. If you're married, you're married. if you're married or you have dependents, children, for example, sometimes your dependents might be your parents. It's not a roommate situation, right? If you live with 2 other people and you're not related to them and you don't claim them on your taxes, they're not part of your household. All right. The open enrollment period is now, and it ends March 31st. If you apply before the 15th of the month, your coverage starts the 1st of the following month. So if you apply by January 15th, coverage is going to start February 1st. If you apply on January 16th, your coverage will start March 1st. There are some special enrollment situations. So the marketplace will close March 31st to kind of the general public. But if you lose your job or you lose your union coverage, for example, after March 31st, or you get married or divorced or have a baby, you can go on to the marketplace and buy insurance after that. But only in those situations, okay? You cannot go back onto the marketplace after March 31st if you decide that you don't like your plan. There's going to be an open enrollment period every year. In 2014, the next open enrollment period is November 15th to January 15th. Okay, where do you go to apply? Since most people here are from New York, you're going to go to nystateofhealth.ny.gov, or you can call that number, 855-355-5777. It will take a little while to get somebody on the phone, but I can tell you that they will literally sit with you on the phone for an hour or 2 hours or however long it takes for you to enroll, okay? If you live elsewhere, there's nobody from California here, so if you live elsewhere, you can go to healthcare.gov or call 800-318-2596 and find a navigator and enroll there, okay? We'll show you the website, the New York State of Health website. There we go. That's what the website looks like. So you'll see there are different tabs at the top, individuals and families. That's where you're going to go if you're an individual looking for insurance. Employers, to enroll in the shop exchange. Employees whose employers are offering insurance on the shop exchange. The others are for brokers and navigators. Everybody is extremely happy on this website. Happy smiling babies, smiling couples. And then the other tab is the healthcare.gov, and this is where you're going to go to apply for insurance for any of the federal exchanges. You can see plans before you apply. You can apply. You can learn about your coverage. They have a drop-down menu, all topics, where they'll tell you about the tax credits and Medicaid expansion or lack thereof and all that stuff. So the websites are getting better, I have to say. When they first rolled out, I'm not going to lie, we were a little bit upset. They hadn't done things like alphabetized lists of insurance companies, so you'd have to go through 400 insurance companies in a drop-down list until you found the one that you were looking for. They've changed those things. It's gotten much, much easier. But as Sarah said, there's still some issues. You would not believe how many systems have to talk to each other for this to work, right? Like, when you go to the doctor, before this system, you probably might have had some problems with your bills, or maybe the hospital didn't bill correctly, or the doctor didn't bill correctly. Just those systems talking to each other was difficult. Now you put in the federal government and the IRS and all that. So anyway, it's been a challenge, but it's getting better. Great, if you could put us back to the PowerPoint. Thank you so much. Okay, so we have dancer enrollment days on Monday and Tuesday. We're about half full. If you would like to enroll in Obamacare, the ACA, I use those terms interchangeably. If you would like to enroll in a plan, please make an appointment. We are seeing people between 10 and 5 p.m. You can go to the Dance USA website, 2014 Dance Forum website, and enroll there. We will sit down with you. We have 2-hour slots, and you bring in your information, your income information, and we will help you enroll.
Do you do this if you're out of state by phone, or is it just a New York-based thing? Like if
So this is New York based because we're only licensed in New York as navigators.
Recommendations of other.
So I would refer you to somebody in Chicago. And if you talk to me afterwards, I can find somebody there for you. You can also go to healthcare.gov, local help, the local help section. It's at the bottom. It says in all other states, go here, localhelp.healthcare.gov. And you can find individual navigators in Chicago. Great. Okay, so Sarah touched on this. Employers do not have to offer coverage. Okay? However, if you get coverage through your employer now and you decide that you don't like it, you can go on the marketplace and buy a plan, but you're not going to get a subsidy for that plan. Okay? The only time that you're going to get subsidized insurance if you are offered insurance through your employer is if the employer's plan is not so hot. So if the employer's plan covers less than 60% of your medical costs, and believe me, there are some union plans out there that are like that, or if it costs you more than 9.5% of your income, then you can go on the marketplace and get subsidies. But otherwise, you can't. Yeah?
How do they figure that out?
How do they know?
Yeah.
You tell them, basically.
So you
Yeah. But you know, they're using, like I said, they're using information from the Department of Labor, you know,
How do you
the,
know that that plan is actually going
Oh.
to cost you that much?
so you would get, like your employer would say, okay, your monthly premium is going to be X, and you know what your monthly wages
So
are.
it's just based on premiums, but not the actual full cost of the plan?
Correct. Yes, exactly. Okay. If you're self-employed, you're no longer going to be able to buy small business insurance. In New York, you used to be able to buy small business insurance as a sole proprietor. You can't do that anymore. However, you can go on the individual exchange and qualify for subsidies and qualify for Medicaid. So how to pick a plan, right? We find when we're working with people that the two areas that they find the most challenging in applying are documenting their income, which we'll talk about later, and picking a plan. Up until now, generally people have gotten insurance through their employer or their spouse or their parent, and you just sort of get what they offer you. You get a plan. You don't have a whole lot of choice. Now we have a system where you have a lot of choice, right? But you also have the responsibility to figure out what is best for you. And you need to do a little research. And you need to look at not just the cost of the premiums, but also the deductible, whether you want a high deductible plan or a low deductible plan, what the out-of-pocket maximum is. The premiums are going to be higher if the deductible and the out-of-pocket maximums are lower. Okay? Do you qualify for subsidies? That could radically change your decision. If you qualify for subsidies, you may be spending $130 a month on insurance instead of $580, for example. And do you qualify for cost-sharing reductions? Cost-sharing reductions apply to people who make less than 2.5 times the federal poverty level, okay? So if you make less than that amount, you're gonna get a break on your deductibles and your copays if you buy a silver level plan. So if you make less than 2.5 times the federal poverty level, the bronze plan is not gonna make a whole lot of sense for you. A silver plan would make much more sense for you. And if you come in, we can talk about the different levels of cost sharing and take a look at how that will impact your decision. Access to care. Is the network that you need? Call your doctors. This is probably the first thing that you should do. Call your doctors and ask them what insurance companies on the marketplace do you accept. Okay, that's extremely important because these are HMOs. And so if you buy an HMO and none of your doctors are on it, you're going to be paying out of pocket for all of your office visits, and you don't want to do that. Okay? So talk to your doctors. Do they accept, for example, Blue Cross Blue Shield or Health Republic or Oscar? What companies do they accept? Consider your health needs. All right? So does the plan offer you what you are looking for? For example, New York has added chiropractic benefits to the list of essential benefits, which is great, right? New York has also added gym reimbursement. So you can be reimbursed for going to the gym on a regular basis. Everybody loves that. It's like everybody's smart. You do have to prove that you're going on a regular basis, but they'll pay you $200 every 6 months, or reimburse you up to $200 every 6 months for going to the gym on a regular basis. The last thing is quality of care. This is a little bit tricky. How do you know which one is a quote-unquote good company? Well, I can tell you that they're all in it to make money, okay? So we still have a for-profit system. This is not socialized medicine. However, what may be the deciding factor for you is perhaps your past experience with an insurance company, or maybe your doctor's experience with companies. So a doctor may be able to tell you, you know what, we've found that this company consistently tries to deny your claims at the beginning and then they put them through or something like that. So think about your own personal experience, maybe talk to your doctors, talk to family members, talk to friends, and that will give you an idea of the quality of care. The biggest thing, though, really is the cost and the size of the network. Those are the two things that you should really focus on. Any questions about that? Yeah.
You referred to something like chiropractic services are now essential.
In New York. Mm-hmm.
Is there like a phrase for it? Essential something or other? Or
Essential benefits, basically.
Okay. And is there
You'll see it. You'll see the website, once you get to the page on the website where you can see all the plans, does a good job, if you click on view details, of really going through what all of the details are, the co-pays, what benefits are offered. Yeah.
Does that mean that for New York-based plans, you have a certain number of visits that are no copay?
No.
That's an essential benefit, not a preventative.
Exactly. Yes, exactly. Okay. The federally mandated essential benefits are outpatient services, emergency services, hospitalization, maternity and newborn care. Believe it or not, most women in this country pre-Obamacare did not have a maternity coverage even if they had insurance. So women would think that they'd have insurance, get pregnant, and then realize that they were not covered for pregnancy. So maternity and newborn care are mandated now. Mental health and substance abuse services. No more limits on mental health benefits, which is great. No more 20-visit limit, etc. Your brain is treated just as any other part of your body. Prescription drug coverage, PT, rehabilitative devices, lab services, chronic disease management, and for children, oral and vision care. However, there's no dental care for adults. You can buy dental insurance separately, but it does not come with the medical plans. Sarah went over this, the federally run exchange plans and what they look like. The bronze plan covers 60%, silver 70%, gold 80%, platinum 90%. The catastrophic plan covers 100% after you meet the deductible. The deductible is $6,350. The catastrophic plan is available to people under the age of 30 or those whose plans have been canceled. I'm sure you heard before Christmas about all the plans that were being canceled. People were really upset about that. So you can buy a catastrophic plan if you were one of those people. The deductibles vary by state, as do the out-of-pocket maximums. Now let's take a look at New York benefits. I talked about chiropractic and gym reimbursement. New York has created standardized plans where the bronze deductible is $3,000. The silver deductible is $2,000, gold is $600, and platinum is $0. Okay? So I think that the state did an excellent job of putting together very comprehensive benefits. I think the federal government did an amazing job of that. My feeling is that these deductibles are kind of high, right? $3,000 is a lot of money. I think they could have done a better job with the deductibles. However, those out-of-pocket maximums are important because, again, the deductible applies to the out-of-pocket maximum. So you still know that you're never going to be paying more than $6,350 per year in medical expenses under the bronze plan, $5,500 for the silver, $4,000 for the gold, and $2,000 for the platinum. $2,000 out-of-pocket maximum is extremely low. That is amazing. So the platinum plan is really pretty impressive, but guess what? It's also the most expensive plan. There is no titanium plan. There's nothing. What about family coverage? If a company offers employee coverage, they have to offer coverage to the child or the children of that employee, but they don't have to offer coverage to the spouse. It's a little spousal loophole here, okay? The employee's insurance has to be affordable, but the family coverage does not have to be affordable, all right? This is another area for advocacy on your part, because it's wonderful if your coverage, your self-only coverage, is less than 9.5% of your income. But if you want your family to be covered, and that family coverage is 20% of your income, that's not going to do you much good, right? So the law simply states it has to be affordable to the individual employee, but not for the family coverage. So what you can do in New York is you can put your kids on Child Health Plus. Child Health Plus is an amazing program that is for every single child in the state of New York. Doesn't matter whether you're rich or poor. All kids in New York can be on Child Health Plus. They're eligible up to the age of 18. And it's free if you're low income. There's low premiums if you're middle income. And if you're high income, you pay the full premium, but that's still cheaper than going on the open market. So think about putting your kids on Child Health Plus. Every state has a version of Child Health Plus. I don't know in Illinois whether Child Health Plus covers families that have higher incomes. So that would be something to look into there. Okay. We talked about the catastrophic plan for people under the age of 30. The nice thing about the catastrophic plan is that you get 3 primary care visits for free. So in addition to the preventive screenings, you get those 3 primary care visits for free. So that could be really appealing for somebody that never goes to the doctor and just wants to get like an annual checkup. It is definitely a New York thing. I'm not sure if the 3 primary care visits for free is a national thing. Is it? It is, yeah. And then under age 26, in any state, you can stay on or enroll in your parents' plan, regardless of anything. In New York, we talked about earlier, there are some stipulations, but you can stay on it up to age 29. Okay, so let's talk about income, because this has been the most confusing aspect of applying for these exchange plans. When you get to the application, they ask you to estimate your 2014 income. I know that that is like impossible for people in this business, right? How do you know what you're going to make? You're just going to have to guess, and you're going to have to give it your best, most educated guess. And here's what you do. The income that you're listing is based on your modified adjusted gross income. So what you want to do is pull out your 1040 tax return, your most recent one, and look at line 37. And that is your adjusted gross income. And then you're going to add any kind of non-taxable Social Security benefits, tax-exempt interest, or foreign earned income. Most people don't have those things. So for most people, modified adjusted gross income is going to be the same as adjusted gross income. You're going to use that as a barometer for what you think you're going to make in 2014. Okay? If you get gifts, for example, a lump sum cash payment, $600 for Christmas, you don't have to declare something like that as part of your income. So what they're looking at, what they want to know is, what do you know you're going to make in 2014? If you have 3 months left of unemployment benefits, you're going to put that into the application. If you get Social Security benefits, you're going to put that in. If you get dividends or residuals, you're going to put that in. But if you had a W-2 job in 2013 and it ended, you don't put that income in, okay? Because it's not going to be income in 2014. If you have a 1099 job and it was just a one-off in 2013, you don't have to put that in. However, if you have a 1099 job that recurs every year, you've got, a regular customer, you would put that in for 2014. Does that make sense? That's awesome. Great. Yes? Mm-hmm.
Some of us use like Schedule Cs
Yes.
because we're charging so much for work-related things or
Yeah.
art-related things.
Yeah.
Is this prior to those deductions? Is the adjusted gross income?
The Schedule C,
Or does that come after?
it comes. So the Schedule C is taken into account when you're looking at line 37.
It is?
Yes.
Oh, I think I did this wrong.
Yeah.
Okay,
So,
go back.
so the good thing about the website is that you have an account and you can go in and change your
I'm doing
application.
that.
Okay. So
Okay.
you contact us.
Okay.
And you can change your application. You can make changes up to March 31st. So if you went with an insurance company and you decided that you know what, I actually don't want to go with whatever X, I want to go with Y, you can switch up to March 31st. After that, you cannot switch anymore.
This is going to give me more government assistance.
Excellent. Great. Okay. Yeah.
For people whose income is wildly variable from
Yes.
year to year, because I know a lot of freelancers will pay their taxes on a quarterly basis.
Yes.
So that they can re-estimate based on how much income they've gotten. Is there some way to do that through this, where you reevaluate your subsidies based on how your income is?
Absolutely. Thank you for bringing that up. And that's something that Sarah mentioned too, that you have to let the government know if your income changes, okay? And so if you're somebody that does it on a quarterly basis, that's great. You can do that. You would be looking at your income every quarter and saying, you know what, I estimated $18,000 for the year, but I'm going to go over $18,000. I think I'm going to be at 24. And so you would contact the government, call the New York State Marketplace, or call the main number for healthcare.gov and say, I got this job, and it's going to pay me $3,000 more than I thought I was going to have in 2014. And they will adjust your subsidies accordingly. So that is very important. A lot of people are very apprehensive about guessing, and I completely understand. It's like everybody says to me, I don't want to lie. I don't know what to. And so just keep in mind that you're giving them your best estimate right now, and it is your responsibility to tell them when that estimate changes. Yeah.
What happens if you bought insurance off the marketplace as an individual, but then are hired into a company that offers insurance? Or what do you do?
You just cancel your marketplace coverage. Yep. Luckily, it's not like cell phone contracts. You're not bound for the rest of your life. So yeah, you just cancel. Yeah.
Well, would that be retroactive, like if you get that job, okay, because if you had a job that offers insurance and you decided not to take it, you don't get the subsidies. But if you were already enrolled in your plan, and then you get an employer that has insurance, are you obligated to drop yours and take theirs?
You are obligated to drop the marketplace plan and take theirs. If it turns out that your income went down, you should get a refund. If your income goes up, right, then you will owe the government some money, which is why you want to keep them apprised whenever your income goes up so that you don't owe them a bundle at the end of the year.
Would you owe them just the credit that you don't get, or would you actually also get a penalty?
You're not going to get a penalty, and what you pay back is capped at certain amounts. However, I think if you go over 6 times the federal poverty level, you have to pay back the full subsidy. But don't quote me on that, I'm not entirely sure. But there are caps at every level of the federal poverty level of what you pay back. Any questions? Okay. All right. We see a lot of people qualify for Medicaid, okay? And that is because a lot of people in our business at this point in time don't know what their income is going to be in 2014, and so they may only have $9,000 worth of guaranteed work at this point, right? So you are eligible for Medicaid. Now, when your income goes up above $16,000 as a single person, you're going to have to let them know, right? And Sarah talked about churning and going back and forth. We'll see what happens, but you would be eligible for the Obamacare marketplace plans with subsidies if your income goes above the Medicaid limit. But a lot of people are eligible for Medicaid now. Medicaid is entirely free and extremely comprehensive. The drawback to Medicaid is that the networks of providers are smaller, right? So it's going to be harder for you to find a doctor that accepts Medicaid. However, you're getting comprehensive coverage for free. So I encourage people not to turn their noses up at Medicaid. I have worked in hospitals all over the city. I worked in a drug rehab in New Haven. I've seen fantastic doctors that accepted Medicaid. These are the states that have expanded Medicaid. Okay, so it's roughly half the states that have expanded Medicaid. Illinois has expanded Medicaid. Yay! Some states are still sort of waffling. If your state has not expanded Medicaid, then you may be in that situation that Sarah mentioned where there's no other way to put it, you're going to be kind of screwed because you are not eligible for Medicaid, maybe because your income is at 50% of the federal poverty level, for example, and your state's cutoff is 49% of the federal poverty level. And as Sarah said, believe it or not, there really are some states where you can't make more than $3,000 a year and qualify for Medicaid, right? So between that and 100% of the federal poverty level are those people who are not eligible for Medicaid and will not get subsidies. Again, a point of advocacy, something to advocate for. Changing that. As far as the subsidies go, by the way, those people that are caught in that little loophole will not be penalized for not having insurance. Okay, so we talked about the subsidies and the fact that you can take them up front every month or wait and file on your tax returns. Here's the subsidy chart. This is what it looks like. So the government is saying the less you make, the more money you're going to get from us to buy insurance. The more you make, the less money you're going to get. So if you make between 2 and 2.5 times the federal poverty level, which is $23,000 to $28,000, $29,000 a year, you're going to be responsible for between 6 and 8% of your income for insurance premiums. So it's pegged at your income, right? In New York, the cheapest plan, the cheapest HMO on the market 6 months ago, not having to do with the exchange, private insurance market, was $1,000 a month, okay? The cheapest. There were family plans that cost $100,000 a year just for premiums, right? The insurance companies did not care what you made. You had to pay that price, okay? Now through the exchange, they do care, basically. The government is saying we need to care what people make because people cannot afford these crazy premiums. So we are going to subsidize those whose incomes are lower and make those premiums more affordable for them. So someone making $22,000 a year will pay roughly 6.3% of their income for insurance premiums, which is about $120 to $130 a month for a silver level plan, and they will have their out-of-pocket medical costs capped at under $4,000 a year, okay, as opposed to $1,000 a month now. Okay, this is where you can go to calculate your subsidy. These are the websites. The first one is for New York. The second one is for all other states. The second one is through the Kaiser Family Foundation, which is a wonderful, wonderful resource. And you can actually go there and figure out how much it's going to cost you, right? And if we have a little bit of time, how are we as far as time goes?
Just 10 minutes.
10 minutes, okay. What I'd like to do, I'm going to have to run to the back of the room, but what I'd like to do is show you the subsidy calculator so that you can get an idea of how to do this on your own. So this is an Excel spreadsheet that you can find on the New York State of Health website for all of you New Yorkers. If you go to the website and type in tax credit estimator, you'll get this Excel spreadsheet, and you can then look at your own situation and put in the number of individuals in your household. So let's say you're a household of one, and so there's one person applying. You have no children. Let's say your annual taxable income is $19,500, okay? And let's say you live in Kings County, because everybody lives in Kings County. And at $19,500, remember, your income is below 2.5 times the federal poverty level. So it is in your best interest to get that silver plan because it has cost sharing reductions. So we're going to look at a silver plan, and you can see here that you're responsible for a little under 5% of your income for insurance premiums. The government's going to give you $285 a month to buy insurance, okay? You're going to give it to your insurance company, not you. So for all of you who were thinking about money laundering, on the left, you'll see the insurance companies selling in Kings County, okay? Then next to that, the full cost of the premium. In the middle, your tax credit, and on the right, you'll see, let me just move it over just a tad, you'll see what you pay every month, okay? So you can see that Affinity, which is a Medicaid HMO, but also selling private insurance now, it's going to cost you $156 a month. Emblem, about $100 a month. Blue Cross Blue Shield, $153. Fidelis, $104. Health Republic, ACA, the Freelancers Union. The Freelancers Union started its own co-op on the exchange, and it's called Health Republic. That's about $100 a month. Health First, $154. Metro Plus, the cheapest at $73. So the cheapest plan for this person who's making a little less than $20,000 a year would be $73 a month, okay? But at this level, this person has no deductible because of the cost-sharing reductions and an out-of-pocket maximum, I believe, of about $2,000. So this is a really good plan for not too much money. Oscar is $133, and then, whoa, United, $356 a month, right? So United is way more expensive across the board, actually, than the other insurance companies. Now, everybody asks me why the difference in price. Part of the reason is the size of networks, right? So all of these insurance companies are offering the exact same benefits at this level, but the network size is different. So for example, United has a very, very large network, whereas Affinity or Fidelis may have smaller networks. Health Republic and Oscar are two new companies that use the MagnaCare network of providers. So when you call your doctors and ask them if they accept Health Republic or Oscar, if they say no, just check and see, do you accept the MagnaCare network of providers, because then they will accept Health Republic and Oscar. But those are two new companies, and they have large networks, but they've lowered their costs because they're new and they want to attract people. What we've been talking about are standard plans. Every insurance company has to offer one standard plan that follows exactly the guidelines that I'd mentioned before, the $3,000 deductible for bronze, etc. Then they can offer what are called non-standard plans. And what that means is that they may make the deductible a little bit lower, but then they'll charge more for certain other things, right? So they can massage their plans just a little bit. They still have to offer all the same essential benefits, but they may decide to make it a little bit more attractive by lowering the deductible. But then you'll have to look and see, oh, the copay for the specialist is higher, for example. That's what they're doing. Health Republic offers acupuncture, for example. So in return for that added benefit, some of their copays are higher than the standard plans. All right, thank you so much, everybody. Really, really appreciate it.
Bye.